Welcome to Break Everything. Your host, Lisa L. Levy, will guide you through critical thought conversations and a journey of directed disruption that makes a difference. Experience bold conversations with industry leaders who are willing to challenge the status quo.
Welcome to today's episode. I am here with our guest today, Dr. Noor Ali. She is a medical doctor with advanced sales experience. She's built a brand around her values, education, love, and service. She helps growing entrepreneurs figure out health insurance in under 15 minutes, or it's free, and it is for free. Wonderful and absolutely amazing disruptive approach. She is on a mission to create a population who feels empowered by healthcare decisions that influence positive health outcomes. Her goal is to help her clients always be least out of pocket for their medical expenses. She is brilliant and highly educated. She's a licensed physician and surgeon. She has a master's in public health, a graduate certificate in infection control, certified professional in public health, licensed life, health, and annuities professional, and she's studying digital marketing at Yale right now. I don't even know how there are enough hours in a day for Dr. Noor to do all of the things that she does. Welcome so much. Thank you for being with us today.
Thank you, Lisa, for that wonderful introduction and this beautiful opportunity. I love this. Thank you so much.
It is absolutely my pleasure. I really would like for you to share with the audience your story. And
sure.
So we know who you are, because that intro, right, is all the stuffy stuff, but it's not actually representative of you as a person. So why don't we just jump right into you?
Okay. Well, my story, Lisa, starts when I'm 5 years old and I'm sitting on my grandfather's lap. We're reading our favorite book together. It happens to be Grey's Anatomy, the #1 anatomy textbook for medical students worldwide. I've got hearts in my eyes as I look up at him. He looks down at me and says, "You're going to be a doctor someday, just like me, aren't you?" "Yes, Dada, I am." And the wheels are in motion. In middle school, I'm taking high school courses. In high school, I'm done taking advanced college courses. So I'm 18 years old, living in the Big Apple, about to start my college career when I get this phone call. "Hello? Dada's died." "What?" My father looks at us and says, "We all have to move back to Bangladesh now." Before I know it, Lisa, I'm standing in 118 degrees sweltering heat, this time clutching my very own Grey's Anatomy as I'm walking across my college campus of my all-women's medical college. And I'm tripping over chickens and goats. In New York City, I would have been eating this off a halal chicken and rice cart. "Dada, where are you? What am I doing here?" My world is upside down. I'm too skinny because I can't eat the food. I'm struggling to communicate with my peers. I'm struggling just to survive. The only thing that gave me comfort during that time was my education. So I dive in deep. One of my professors recognizes my ambition and says, "Hey, you're really good at surgery. You just timed 16 minutes and 30 seconds for the C-section. No one's ever done that before." I was on a roll. In my free time, I founded this internationally award-winning community project providing free antenatal care to slum-dwelling pregnant women all over Bangladesh. My work was awarded by the United Nations in 2014. I'm 23 years old in my final year of medical school, and love is the last thing on my mind. A man that I met 6 years earlier finds me halfway across the globe. He asked my father if we can go on a date. "Sure, if you marry her." "Okay, can I have some time to think about this?" "Yeah, I'll give you 15 minutes. That conversation was on a Wednesday. By Friday evening, we were married. That road showed up pretty quickly, but I took it and I never looked back. So the beginning of the road is rocky, full of uneven potholes, long distance troubles, but I'm thriving in my surgical career. So 2 years go by, and it's time for me to move back to United States and live with my husband and start our family together. I was a superstar surgeon in Bangladesh, but in America, I'm just a high school graduate on paper. I have to pass my United States medical licensing exams in order to practice surgery. I'm mopping floors at my first job back in the States. at a Subway sandwich shop. And all I can think about is this exam. It it's like this big, enormous fire-breathing dragon. And the heat of it terrifies me and it melts my armor. I'm truly terrified. I finally get my test results back, and it's not what I expected. I missed it by one question. Now what am I going to do? Hello, sunny Florida. I'm 26 years old, living with my in-laws, and I'm trying out all these different careers, but nothing makes me feel worthy until this opportunity for health insurance. Health insurance, they never taught this in medical school. I dive in deep. It's my second week of training, and I'm handed this medical underwriting guide. Amy, next to me, is hitting up Google every other second and trying to pronounce words like cholecystectomy. It's cholecystectomy, resection of the gallbladder, indicated in cholelithiasis in some cases of chronic cholecystitis. It's like I was reading Grey's Anatomy again, and I'm fluent in this language. And that's when I knew that my road just merged into my path. With my clinical background and expertise, my master's studying in public health systems globally, and now my years of experience in health insurance, I was creating the new Dr. Noor Health brand. Using my experiences, the value that I can bring to the table is really my clinical know-how and my deep desire for social justice. What I do now is I help female entrepreneurs, really all growth phase business owners all over the country, help and identify which health insurance plan is going to serve them best, and help them do that medical evaluation and find out really what kind of coverage they need, and sometimes more importantly, what they don't. I've, been on many roads, less traveled, and learned a lot, but I've always trusted in myself that I'm really going to figure it out. And here I am. And that's really the richness of life. What do you think, Lisa?
Oh my gosh, Noor, I've heard your story before, and that is how we ended up having this conversation today. I am so in awe of you and what you've accomplished in your life and how you've taken each obstacle and grown so much from it. As you're building the brand of Dr. Noor, and in that brand, you are solving business problems. What's the best part of what you do with your clients day in and day out?
What I love about when I deal with my clients is how touched and inspired I get. When I speak to someone, they come to me seeking help, and yes, I'm helping them, but the byproduct is I'm getting so inspired. Like, Lisa, when I heard your story, when you reached out connecting with me, I was like, wow. When I was researching you, I was like, I am so inspired. So I think that's what I love so much is when my work trying to help others, I end up getting so inspired and fueled, and it just lifts me up higher and higher. And I love that about my day to day.
That's fabulous. And in your story, you sort of talk about how you went from being in medicine and making that transition into health insurance. But it's a powerful combination. How do you really leverage that for your clients and for your own growth?
Sure. I wanted to reference something. I've been called a fox in a hen house. And at that time, I didn't really know how to take it. I was like, is that negative? Is that positive? I don't really know. And it's been challenging. Initially, it was, first of all, in the beginning, I would hide my background very much. I would never reveal that I have a medical background or a surgical degree because I was ashamed. I was embarrassed. I was like, oh, well, I'm in a career in sales now, and that really doesn't even barely, for some roles, doesn't even require a high school education, let alone a college one. And here I am with all of these advanced degrees, and I would really separate and isolate and try to hide that part of my background. And it took a while. It took years for me to bring it out, and only now am I so public about my story. Literally just weeks old am I really stepping into this. And I can't say that I'm too comfortable just yet either. I'm just getting comfortable with it. So to answer your question, I don't know. I haven't yet experienced that. I'm just now stepping into how to marry my previous history with what I do now and make it beautiful and presentable. I'm still working on that.
So you do know that if you want to take the fox in the hen house and hold on to that and take it and make it powerful, right? The knowledge that you have from your formal education and what you bring to your sales role and your clients is formidable. And in this being called the fox in the hen house, I would take that as high praise.
Okay. Well, thank you for that feedback, because at that time
I
I
would own
wasn't
that.
sure. I like that word, formidable. I love it. I want to take it and I want to run with it.
Absolutely. When you're working with your clients, with your business owners, what do they need to know when they're shopping for health insurance?
Sure. It's a tough world out there, Lisa. And what I really want everyone to know as a business owner when shopping for health insurance, you want to keep your research in two separate spheres. You've got the public sphere and the private sphere. Excuse me, let's start with the public. The public health insurance market that's federally sponsored. Each state kind of has their own version of the marketplace, also known as healthcare.gov, previously politically known as Obamacare and now Biden Care. That's all synonymous. That's the same thing. Now, anyone and everyone can get a plan there. After the advent of the Affordable Care Act in 2008, all plans are guaranteed issue, which means regardless of your, pre-existing condition history, you can get a plan. And that's awesome. That's perfectly fine. However, for those business owners who are earning more than 400% above the federal poverty level, and I'll give some examples of what exactly that is, you're not really getting a good deal. In fact, healthcare is very, very, very expensive, because in order for those insurance companies to remain profitable, because they're taking on so much risk, they're taking on anyone and everyone, rich, poor, old, sick, healthy, whatever. The plans on the marketplace come with very high deductibles, and again, high premiums if you are earning more than, let's say, 50K as a household size of one. Household size of two goes to 80K. So if you're a business earning over six figures, the public marketplace is just not a great place to find a health insurance plan. Okay, so keep that in mind. If you're very low income or you're chronically ill, go for the public marketplace. But if you're generally healthy and earning over six figures, the private sphere is going to be a better bet. Now, in the private sphere, there's so many options, Lisa, it can get really daunting, especially because if you start Googling and researching, there's no neat little portal with a list of plans for you to click and compare and say from. It's a capitalist economy. Google is going to show you what the big companies with the deep pockets have, who can afford that ad spend, what they want you to see. So this is where I suggest working with an advisor like myself. It's free to get advice, just to get some professional advice, and we can really help you kind of filter down and help guide that research. So that's my advice for business owners.
And it's important advice, because health insurance and the role that it plays in our society in America has changed over the decades. And if we were to roll it back 30 or 40 years, right, it was not something that everybody had access to. And people paid their doctor cash money out of their pocket for services rendered. In the last 20 to 30 years, the rise of employer-funded health insurance has become an expectation. I remember graduating from college and I was so excited to get my first job where they offered benefits that I was like, I have something that I never had growing up as a kid, because my parents were entrepreneurs. And there were things, and different kinds of things, but, I'll use I had braces, right? And being told how expensive that was. And, that little threat that they kept over my head to brush my teeth and do all the right things because of the money they were spending on my face. Today, my stepchildren, right, they went to the orthodontist and we had insurance that covered that. It's very different. And depending on the size of the business, right, what we can actually afford, and how, one of the things you talk about are the things that you may not actually need. Right. And we have those expectations. What are a couple of those ideas when you're talking with smaller businesses that are probably profitable, but insurances that aren't necessarily required?
Yes. I'll answer your question in two parts, because I want to address what you said, because you had some very valuable information there, which is the history of healthcare in America, right? We had no employer-sponsored coverage. Then we had employer-sponsored coverage, and it became the norm and the expectation. But then that's only 50% of Americans who are, who have a corporate role. What about the other 50% who are self-employed and business owners? Then you had the ACA in 2008, which was awesome in theory, but then those who are making a lot of money, it wasn't awesome at all. It was actually awful. So then you have these kind of, in the last 2 decades, you have these thoughts of, oh, health insurance is a scam. It's all too expensive, because that's all they know and all they see after 2008 is the marketplace, and that's the only thing. But it's not the only thing. But how are consumers supposed to know that? Because there isn't, wide privatized education. There's private insurance plan out there, but how do you know? And there's no portal, right? So thank you for demonstrating that history, because the evolution really speaks to mindsets and expectations of consumers, and when it comes to healthcare. So that's really important. So to your question, what's needed and what's not. So when we talk about small businesses, under 50, or let's say under 10 even, the options of flexibility are so much more greater. It's actually so much fun. I love working with this group because there's a lot that we can do. Here's the first question I ask, Lisa, when a business owner comes to me and they said, hey, I'm thinking about offering insurance to this hire. They've been with us a long time. I don't even know where to start. Here's my question to them. What does your employee want? And it's such a powerful question, right?
Whoever asks that question.
They don't, and they don't think to. And I'm like, that's what I want to know. And they're like, oh, well, I don't know what they want. I'm like, well, either you ask them or connect them to me and I'm going to ask them. Because when you ask directly what your employee wants, you can build a plan around their needs and their wants. And it actually saves so much money because you're not giving frivolous coverage that they may or may not need. They are so much happier, which results in employee retention. And I take it a step further and I add, hey, if you're working with someone in a freelance capacity or a part-time capacity, why don't you have them be the policy owner? The company, the employer, doesn't necessarily have to be the owner of the policy. You can, your employee can own the policy. You can pay the full premium if your budget allows. You can pay a portion of that depending your budget, or you can offer a fixed stipend or credit towards their health insurance premium, which actually is less administrative burden on the business owner side. So there's so much flexible options, and it all starts with that one question. What does your employee want?
So I want to dig into a couple of things in that, because you shared things I have never thought about. First, you were talking about, right, asking, what do your employees want, right? Who really has ever done that in the space of, how we provide, health insurance for our employees. So yes, voice of the customer. It's, from a business practice, we use it all the time. Turning it inside is really kind of new, and I'll throw it out there, right? It's applying disruption with purpose.
Yes, I love that.
I love it. You also talked about, offering it so that the employee or the freelancer is the policy owner. You're talking with businesses about paying for a percentage of health insurance for freelancers. Who thinks about that? What an amazing way to build loyalty without having to build the overhead of the HR side of employees. So I will tell you, in my business, I carry no W-2 employees, right? We are all partners. We are corp to corp, some 1099. I would love to have insurance for that larger pool of people. And nobody has ever even proposed that there was a way to get there from here. That is brilliant.
Yes, and I'm just like you too, Lisa. I've got a team, and some of them are abroad, and this insurance may not apply, and some of them are here. They're 1099, they're freelance, but I value what they've done for me, for my company, and I want to show that appreciation by giving something back. Now, I'm still growing. I may not be able to afford a full premium, but I know in my situation, my 1099 employees don't have any other resource for health insurance. I know that for a fact. So how can I help to solve that? I can offer it, and I can offer maybe a small stipend towards it, whatever I can afford. And that makes me feel really, really good.
Well, and the types of plans that you're talking about. So, I guess the question is going to get to, which health insurance is best.
Yeah.
But I think you need to educate us a little bit, because we're going to start with my expectations of the traditional, the HMO, the PPO, those things that corporate employers have provided. But I'm guessing that you're going to take us down a path of things that are totally not that at all. So what's best?
Yeah, and that's a trick question, Lisa. And the answer is there is no best. You can't say that, because I get that question a lot. Like, which health insurance company should I go with? It doesn't matter. You know what's a good health insurance, Lisa? When your health insurance plan covers what you want it to cover. That's when you're going to be happy. right? When you can see the doctor that you like to, when you go in for a service and you don't come home with a big surprise bill, when you know that, oh gosh, I'm going to have a baby this year. I got to make sure that I got to know how much it's going to cost to have this baby. Or, I really need this surgery. How much is it going to cost? So those are the conversations that we have right at the get-go before I'm going to tell you which health insurance plan is best. And here's a secret. It's different for everybody. There is no one size fits all. But since you mentioned HMO, PPO a little, I will speak to that. So HMO and PPO actually refer to the network of providers that you have access to. So you can have the most amazing, beautiful plan that covers you head to toe, costs you $0.00, but if you can only see the doctor that lives 50 miles away and has a 3-month waiting schedule, you're not going to be happy. So an HMO stands for Health Maintenance Organization. It's a limited network, typically only in the locality that you live in, whereas a PPO plan stands for Preferred Provider Organization, and it crosses state lines and it works all over the nation. And it's a much more quality preferred plan, especially when you've got remote employees who might want to just, move around because they can. And that's the trend that we've been seeing, especially after the pandemic, is how do we serve these remote employees? And that's where a PPO type plan can really come into clutch. When it comes to benefits, we just got to have a conversation to figure that out, because let's customize it. Like, why not? But when it comes to the network, I always suggest to go with the PPO plan.
Fabulous. So you kind of gave me some breadcrumbs in that, as we are coming out of the pandemic, our work environment is different, but the healthcare industry has gone through tremendous upheaval. And I know with your background and your experience, right, the health insurance side is part of where you play, but in healthcare in general, what are you seeing are some challenges that we need to work through to come out of this pandemic stronger? And be more in control of our own health needs, our health and wellness.
Sure. Yeah. I think that the data that we've received from the pandemic is so rich, and it's something that we can use to be better as human beings and to care for each other. So challenge-wise, definitely mental health was a huge, huge challenge during the pandemic. And one of the biggest requests that I received from people who need health insurance is, give me the one with the most mental health coverage. And this is a tough one for me, Lisa, because if we go back to the ACA, Affordable Care Act 2008, the way to define a health insurance plan as ACA compliant is if it fulfills the 10 minimum essential health benefits. And one of those 10 is mental health, right? So to get great mental health coverage, the marketplace is a great place to look. However, if you're earning a lot of money and you're, need quality PPO coverage and you're generally healthy, you just need the mental health piece, that's probably not a good fit. So this is a challenge that I have personally daily to try to communicate to people. I understand that you need great mental health coverage, but is it worth it to go with a marketplace plan that's going to have a high deductible HMO networks just for that mental health coverage? Or can we consider a private option that may not have 100% of that mental health coverage, but if we calculate your out-of-pockets, spending a little bit out of pocket on mental health coverage and saving hundreds, maybe even thousands on premiums is still kind of worth it in the long run. So that's kind of the perspective that I try to offer professionally. And it is challenging for me because people are set in their ways and I only have 15 minutes to convey this valuable information. But those are some of the things that I try to make that evaluation for. So I understand you have this need. And even though at face value, it might look like, oh, well, this is the better option. Actually, if we run the numbers and do the math, this is the better option.
And the math is hard sometimes, right? When you start to understand and want to try and qualify your premium cost versus your co-pays versus your deductibles. And then, here I go to the doctor every month for something versus I go once a year for my annual exams. And that's a lot of math and a lot to paint a picture. But I'm assuming that you're doing this in 15 minutes, that you have a way of putting a really quick here in your face comparison that says what you think health insurance is and what it costs. And this private side, there are some significant benefits financially.
Yep, and you're absolutely right. I can make that evaluation in a snap, and I do that on a daily basis. And for me, it's very easy. If you share that information with me, like you just did, kind of a picture of your health, your
Right.
frequency of seeking care, kind of what you need on a recurring basis. It's very easy for me to do that evaluation because I've done this so often. And what I'm so grateful for is my clients trust me for my recommendation. They trust in my
Mhm.
expertise, and they take my word. And it's always worked out because one of the services that I offer is I will not recommend a plan to you that doesn't come with my concierge service attached to it. So once I write you a health insurance plan, I'm not going anywhere. I'm actually I come with the plan trying to help and advise you to make sure that you're not overspending on day-to-day services or when you're seeking care and when you actually need to use your health insurance.
That is absolutely fabulous. Um, what opportunities do you see for the field? Do you see in healthcare and in health insurance for the future? What are what's that low-hanging fruit that we should all take advantage of in the near term?
Yeah, I'll give that answer in two prong. We've got the physician and provider side, and we've got the patient and consumer side. And the answer is telehealth and telemedicine. I think that was big during COVID because no one really wanted to sit in an urgent care room or an emergency
Mm.
waiting room full of COVID, and they sought care via telehealth, and that turned out really, really well. A lot of people found out like, oh, hey, I can get treated for this, and from the comfort of my own home. That's awesome. And same for physicians. If there's I have a lot of friends in the field who risked their lives during COVID, and maybe they don't want to do that again or anymore. So being a provider as on a telehealth basis is actually a really great way to create income and still serve your community.
Absolutely. And I'm sorry, on the other side, on the
Uh,
patient
Patient just telemedicine as well. So taking
is
advantage of medical services through technology and an app instead of going in person saves you money and it saves you time as well.
it absolutely does. And what's happening in telemedicine and even concierge medicine,
Yes.
right? That interpersonal interaction with a physician is changing for the better in terms of the length of time that we can actually interact with our providers.
Yes.
That 15-minute clock from that CMS perspective is a little bit it's being overwhelmed for an improved patient experience, I guess is what I'm trying to get to.
Yes,
Sorry,
absolutely.
that
I
was hard
agree.
to get out of my mouth
That's
for some
okay.
reason.
I got it.
Oh well. Noor, at the end of every podcast, I have a single question that I ask everybody because part of this platform is wanting to be disruptive with purpose and to shake things up in terms of how we think and how we see what's possible for the future. So if I gave you a magic wand, what thing would you change about the industry or for the industry? There are no constraints. Cost is irrelevant. I want you to dream as big as you possibly can and make a positive impact.
Okay. Well, my answer is going to be a little complex, but stay with me because I believe in this. I would like to remove the constraints of capitalism when it comes to healthcare delivery, because I feel like it detracts from the theories of social justice. So I'm going to draw on an example here that I think you can relate to. It's well, here. Let me zoom out a little bit. Let me back up a little bit. Here's what has happened because our economy is ingrained so much in capitalism, and it's not a good or a bad thing. It is what it is, right? We've got insurance conglomerates, Blue Cross
Mm.
Blue Shield, United Healthcare, whatever you want to call it. I'm not knocking on any companies. I'm just painting a picture of the landscape,
Yep.
right? And what has happened is they've just monopolized the industry to the extent that the consumer and the patient feel so small and underrepresented. It's really made the industry difficult for service providers like myself. Now, my limitation is I don't have a license to practice in the States, or I would love to provide that concierge door to door service. But because the insurance conglomerates have monopolized the industry so much, and now we have patients who feel underrepresented and not served, we have physicians who are underpaid and overworked and not given proper representation, it's resulted in these solutions like direct patient care, like concierge service, because doctors are just not getting paid enough by insurance companies. So they have to figure out their own solution on how to make money to feed their families, right? And now patients don't know what the heck to do with insurance. They oftentimes they end up making the wrong choice because they don't have access to resources or professionals like myself to help them make the decision. And it's just this vicious cycle of the patient not winning, the doctor's not winning, and the insurance company is kind of winning. It's just, it is what it is. Now, I can't, because of my limitations, I don't have license to practice medicine in the States. I can't single-handedly go and change the system or do anything about that. But what I have done and what I try to do is just use my knowledge to try to educate and help you make the right choice in the system, in this landscape that we're at right now. So that's really my wish, is if we can kind of subtract the equation, subtract the factorial of capitalism from the equation of healthcare delivery and outcome in this country, I think we can make a bigger impact when it comes to social justice delivery.
And that's a really interesting perspective. Taking capitalism out of it is going to be controversial to some, right? That language in and of itself is going to just irk some people. But if you really pull back, what you're talking about is getting to quality care, the right time at the right price for everybody, and being able to engage in their healthcare, and that it's not first and foremost about large corporations making money. And so I think it's a very good want and dream for the future, because we should have the ability to access healthcare.
Yeah, and I'm sorry, Lisa, I'm speaking on the perspective of coming from an insurance lens is how I made that statement, because I'm benefiting from capitalism as well. It's how our country runs, and I'm not knocking on that. I'm just saying, how that's impacted the insurance industry and what we can do about it.
Oh, absolutely. And I could go off on a rant about pricing and price transparency for services in the industry, right? And what an insurance company is willing to pay and they charge. And if you actually just, had a handful of cash, what that service would cost.
Yes.
But that's for a different conversation another day. And I think we've had a wonderful chat today. Noor, I so appreciate your perspective, and the world of health insurance is something that we all live with and are often frustrated by, because we don't understand what's possible. And you're bringing to market offerings that have always existed, but we just don't know that they're there. And so you are evangelizing the options beyond the traditionally known corporate kind of options. I appreciate your perspective. I so enjoyed hearing your story. Every time I hear it, I just am so in awe of who you are and what you do. Thank you so much for being with us today. And we look forward to sharing this with your community. What's the easiest way for people to find you?
Thank you so much again, Lisa, for this opportunity. Such a pleasure to be a guest on the show today. My website would probably be the best. It's www.drnoorhealth.com. That's DRNOORHEALTH.com. I'm also very active on social media. You can follow my life and stories on my Instagram. That's dr.noorhealth. On Instagram, and of course, LinkedIn. I'd love to connect professionally. That's my favorite platform. So find me and connect with me.
Fantastic. That's it for today, folks. Thank you so much for joining us.
You have just experienced Break Everything with Lisa L. Levy. Critical conversations on directed disruption that makes a difference.